Okay, good afternoon, everyone, and good morning, depending on where you are calling in from. My name is Chris Shama, and I'm the Deputy Regional Representative with the CALP Network, hosting the MENA webinar series in collaboration with WRC and CARE. Today, we're hosting the second webinar of the webinar series, looking at gender-based violence and cash transfer assistance with a specific look at the experience and expertise from Jordan. Before we start, I'd like to let you know and remind you that their interpretation is available. At the bottom right corner of your screen, you should be able to see an interpretation button. Click on that and then click on your preferred language. I'm going to repeat this now in Arabic. أهلا وسهلا فيكم للأشخاص اللي انضموا.
Welcome for anyone who's joining us.
لنا هلا بس بدي أخبركم إنه قادرين تختاروا الترجمة باللغة العربية أو بالإنجليزية. على الزاوية على اليمين على الشاشة تبعكم فيكم تضغطوا على فيكم تضغطوا على القدرة كرمال الترجمة وبتختاروا اللغة العربية لإلكم.
You can choose the Arabic language.
Okay. So I'm just going to quickly go over the housekeeping rules for this webinar. The event will last for 90 minutes. You are able to submit questions, and please submit questions in the Q&A box at the bottom of your screen. Because we're concerned that we might not pick up on the questions that you would drop in the chat. Your mics and video cameras have been muted for this event. The event is recorded and will be shared at a later point in both Arabic and English. And in the case of a Zoom hacker, staff will remove and block the offender from all future events. Now, without further ado, I would like to introduce our panelists joining us today to share their experience from Jordan. Maram, over to you. Maram, you're on mute, my dear. So sorry.
يعطيكم العافية. أنا مرام منسقة مشروع في مركز توعية بالتغيير.
Good day, my name is Maram. I'm the project coordinator. I cannot hear you.
مشروع تحسين الرفاه والحماية الاجتماعية بالتعاون مع
I cannot hear.
Thanks, Maram. وأهلا وسهلا فيك.
Thank you, Maram, and you're welcome.
Hi everyone, good afternoon. This is Lubna Al-Kanda. I'm from InterSource, working and based in Jordan. I'm the protection coordinator, but also at the same time, I'm co-chair to a task force in Jordan, the Prevention from Sexual Exploitation and Abuse task force, and also at the same time, Cash for Protection task force. Thank you.
Nice to meet you, Lubna, and welcome to the panelists today. Last but not least, over to you, Noor.
Good afternoon, everyone. This is Noor Saide, the Director of Protection and Community Engagement Program in CARE Jordan. I oversee the protection programs in both settings, urban areas and Azraq camp.
Thank you very much, and thank you for joining us today. We're very excited about everything you have to share with us. We're going to start off with presentations from the panelists, briefly telling us about their contexts and their programs before we delve into questions with them. And yeah, rest assured that there will be a Q&A session at the end of this webinar. So I'm going to hand over back to you, Noor. Kick us off with what CARE does in Jordan.
Thank you, Chris. Again, good afternoon, everyone. Let's talk about the social protection systems in Jordan. There are two systems, one managed by the government targeting host communities, And we're having two main umbrellas. We're having the National Fund Aid, and this is managed by the Ministry of Social Development, usually provide ongoing benefits for vulnerable participants and sometimes providing one payments in some cases. Another umbrella in Jordan, we're having Zakat Fund, providing two types of assistance, cash and in-kind assistance. And this umbrella or entity managed by the Ministry of Awqaf, Islamic Affairs and Holy Places. There are a cooperation started in 2017 with UNHCR to serve eligible cases, individuals who are not supported by the system. Another system targeting Syrian refugees and other nationalities, usually supported by INGOs and UNHCR. For non-Syrian refugees or persons of concern, they have to register with UNHCR in order to access assistance. And they are eligible also for vouchers from World Food Programming. Next, please. The context in Jordan. So Jordan is a host to the second largest refugee population per capita in the world. Total population of Jordan stands around 10 million inhabitants, including 751,000 registered asylum seekers. Out of this, we're having around 624,000 live outside the camp in urban areas. GBV programming, gender-based violence programming, remain a challenge in Jordan, affecting in all its shapes or forms, affecting both communities, host communities and refugee communities. And also as a result of COVID-19 pandemic, there were lockdowns, less or lost incomes. There are also tension between the households and barriers to reach different services. We would like to highlight also the gap among the humanitarian funding and the programming. We're phasing out from the humanitarian toward more development, and also multiple CVA for cash assistance responding to the challenges. It's critical for all the humanitarian responders in Jordan. There are also lack of GBV, gender-based violence case management at the government level and the national systems. And also I would like to highlight there are linkages, the linkages between GPV, CVA, livelihood, women economic empowerment programming missing or needs to be increased and strengthened. Next, please. In Cape Jordan, we're following the model that you can see in the screen. Basically, we're using the case management as an entry point to provide all the services inside care. We start with the case manager assessing or conducting vulnerability assessment, in-depth assessment. In addition to the vulnerability assessment, we're having the updated assessment covers both opportunity-led and vulnerability-led assessment. After the assessment, case managers, they develop care service plan where they identify a needs for cash assistance and other assistance, of course, and where the case managers in this case refer the cases for cash assistance, different types of cash assistance. Referrals come internally or externally. We have internal programs provided by other colleagues in different departments, and also a referral takes place to other services like health, mental health, legal, and psychosocial support, in addition to the livelihood activities. After that, we're having a follow-up by the case managers and with other stakeholders, either internally or externally, in order to close and make sure the case received all the services and closing the case. Thank you very much.
Thank you, Noor. I'm going to now hand over to Lubna to talk to us about what InterSource is doing in Jordan.
Hi, everyone. Okay, for InterSource, we are working in Jordan since 2012, and InterSource, of course, it's a protection mandate organization, Italian organization. We are working usually in urban area and semi-urban area, especially rural and countryside area. Our current project focus mainly on GBV prevention and response. Of course, we have different donors. Currently, we have ECHO, we have IX, and we have also OCHA, UN OCHA. Of course, also InterSource very focused on 6 governorates. We are currently working in 6 governorates in Jordan: Amman, Irbid, Madaba, Ma'an, Tafila, and Karakol. So mainly InterSource program, as you can see, this is the kind of activities we do under case management, which is GBV case management services package. We provide psychosocial support, including individual and group counseling, psychological counseling. We also provide legal assistance through InterSource lawyer. We also provide cash assistance, of course, as a part of the case management services. We also have the internal and external services, and of course, we depend a lot in InterSource on the community-based outreach activities and preventive activities as our main entry point. Also, at the same time, we work a lot on the local community capacity building. Next. If I'm going to talk first of all about the needs, exactly, I'm not going to go again for the context, especially that Noor from CARE already, I think, explained very enough and completely. So I will go for the needs and possibility. For us as an InterSource, our main issue now is the needs for multiple shots for GBV, multiple shots of the cash assistance for GBV survivor. And we usually try to overcome this through the survivor-centered approach. We make sure that our case managers always depend on the case management plan through the risk assessment, because we are believed for sure in the survivor-centered approach. And we understand very well that each case has its own needs, and definitely that's reflected in different action plan or case management plan. Also, at the same time, we have the different transfer modality. Until now in Jordan, and especially as an InterSource, we still depend on different transfer modality because we are targeting a lot of marginalized group. We're targeting a lot of refugees that they have issued that they cannot access actually the money transfer agents or the banks or ITM machines. And as I explained about the marginalized group, we focus a lot on the, let's say, very marginalized and very critical and very vulnerable actually groups that's not easily for them to access actually even our main offices or the services. So we are always working on not let them reaching us, but we go the step we take the step, the extra step, and we try to reach for them. And the other thing we actually focus on it, and we really think it's needed now in Jordan, and especially with InterSource, it's the long-term solution and the sustainability for the survivor GBV, for GBV survivors. Because currently we have a lot of cash assistant, or let's say we have kind of limited cash assistant in the GBV programming, but this is definitely do not reach to the sustainable or let's say longer term solution. So we make sure and we focus with our case management team on having the safety plan, and we make sure that this safety plan or safety net is very linked to the exit strategy of these cases. Definitely, currently we are depending a lot on our inside or let's say our internal house capacity, and also at the same time we encourage our case management team to build their own service map that definitely focused on the livelihood component for external referral. Also, at the same time, InterSource, in order to, let's say, boost this option, we're also working through a lot of local community-based organizations, and also we are creating now our own network and make sure that we have a lot of, as I say, a lot of local partners, local actors like Foxes. They are our main partner here in Jordan, but also at the same time, we try also to explore another. Let's say, even governmental and non-governmental local capacity. Next. For InterSource, yes.
Look, just, I just want to tell you that just slow down just a bit, please.
Okay.
Thank you. Sorry. It's very interesting, but we're trying to keep up.
Okay, clear. For the process and the program models we have in the InterSource currently, we have definitely the GBV case management. Our case management service package, we try to say it's a comprehensive case management package. We included the psychosocial support in all its level, let's say psychological first aid, psychological counseling, whether it's collective or individual. Also, at the same time, we depend a lot also on the legal assistance. And this year we are trying to, let's say, make it even more wide and more expand. We are not only now providing let's say, counseling or advising, legal counseling or advising, but we're trying to pass to the representation, definitely for limited cases, but we are trying to explore this. Also, at the same time, we are depending on having really good cash assistance and link it to the risk assessment reflected in the safety plan. As I say in the beginning, the follow-up and the safety plan is very important for us in order to overcome and, let's say, reaching to the longer term solution for the GBV survivor. Also, in the intersource, we are depending also on the cash assistance, not depending a lot, but it's very linked to the case management, the cash assistance. So make sure that case managers are really equipped and really capacitated to able to identify the cases properly and identify actually the amount of the cash assistant, the frequency, and even the delivery mechanism. This is very important for us because it's very linked to the limitation of the cash assistant and also to applying the do no harm principle. And the last thing, in order to complete, let's say, and make it like a complete circle, we are depending a lot on also on the monitoring activities. We are do two types of monitoring. First of all, we have the satisfaction survey and the BDMs, and both of them, they actually can give us a correct information on the quality of our services, the accessibility and the safety, and also the dignity when we are providing services. Thank you. Next.
Thank you, Lubna, for sharing that. I'm now going to hand over to our colleague, Maram. Maram, تفضلي.
يعطيكم العافية جميعا.
Good day, everyone. Thank you very much for my colleagues. I will try not to repeat the things that has already been mentioned. We are working on two components. First of all, it's HIV and STDs, and then also we work on GBV. Regarding the prevention, the program of the GBV prevention and program, we start, I cannot hear.
طبعا هي بتكون بالتشارك مع السي بي اوز والجمعيات المحليه بالاضافه للجلسات النقاشيه المعمقه حول الجنس والجندر والقوه وما الى ذلك. بالنسبه لانشطه الوقايه والاستجابه اللي هي
regarding the activities of prevention and responding, I cannot hear. I can't hear.
مرام سمعتيني؟
I can't hear.
بعتذر عم قطشك حاليا بس الميكروفون بس اذا فينا نقربه شوي كرمال المترجم يقدر يلحق لك. بس فيك تجربي هلا.
Hear properly. I'm sorry. Yeah, maybe. Let's try. In addition to the counseling and psychological support, we also work on GBV case management and cash assistance and referrals. And this is common activities between organizations. Next slide. Through our work with InterSource, we provide protection services and using the standard operating procedures. We are looking for cash for protection as a preventive or complementary measure in order to respond to urgent cases and immediate cases, and also to respond to the consequences of protection. I'm sorry. Thank you very much. I couldn't hear properly.
So thank you again to our panelists for presenting a bit of a background on the context and the programs that they're working with in Jordan. We're now going to move forward with a few questions for our panelists. So in terms of, in each environment, we have aspects that contribute to program design and others that might pose more of a challenge when thinking about how things should happen, of course, keeping users and the people in mind at the center of everything we do. So Noor, I'd like to learn a bit more from you in terms of what were enablers from your experience and in your role with Care Jordan that positively contributed to program design, implementation, or even evaluation?
Yeah, thank you. Allow me to rely or use the annual needs assessment that CARES usually every year conduct. And first enabler that was there is a need for GPV services to be conducted through case management at national level. This is obviously mentioned in all the strategies newly developed by the government, specifically MOSD and also public security departments, in addition to others. And there is a need also to link CVA with GPV service, with GPV case management services. This is first point. The second point, I would like to mention the lessons learned after COVID-19 and as a consequences or impact of COVID-19 that we invested in digitalization. So this is another way to inform our program design. And here we're talking about a new system, and new tools created to integrate and enhance the delivery mechanism for the CVA programming and the integration with the case management. For example, CARE developed what we call digital information boards, where we spread or send massive messages to thousands of people in need. This is in regard for the variety of GPV service providers and also CVA assistance to those needy people. Would like also to highlight the importance of having contact center. We call a contact center also, it might be used as a platform for sharing information about the available service provider in the country by different GPV service provider. Would like also to talk about the post distribution monitoring mechanism that we following after every single cash delivery linked with the case management. As mentioned in my presentation, we're using case management as an entry point to identify and refer people in need to our different cash assistance. We're having different programs or types of cash. We're having emergency cash, we're having cash for utilization, cash for maintenance, and also we are providing cash for shelter. These different types. So we are relying on the feedback received after or during the monitoring, post-monitoring process to inform our new program design. We're also talking about the having equality, ensuring equality in terms of the referral for those who we cannot serve them in-house. We're providing psychosocial support, women empowerment, women economic empowerment services and livelihood services, in addition to the education programs, etc. So for those we cannot serve them internally, we make sure that they are referred on timely manner to the colleagues, peer organization providing similar services. I mean, we cannot provide it, but they are in need. So we make sure that quality referral pathways taking place through the existing platforms. So yeah, this is from my end, I think the main enablers that we usually rely on.
Thanks, Noor, and it's very interesting. I think Jordan is one of the excellent examples in the MENA region that has really shown a lot of excellent examples on digitization and digital information and transformation. And we'll pick up on that maybe a bit down in our conversation. Maram, over to you. What are the enablers from your perspective when it came to designing programs in Jordan?
كبداية للشق الأول من السؤال
بالنسبة first for me there is professional capabilities in GBV, and we have been equipped with that, and now we can work with GBV program with marginalized communities. We provide them with services like health programs, and now we are much more responding of cases related to GBV. For the second part of your question, we have community recognition of the existence of GBV. We still hear about cases that is related to violence, and there are many forms of this violence. and it became as community cause, and that maybe ease the implementation of such programs. And as an example about the project tools with InterSource, we can see that there is a change in the direction of the violence case through the awareness sessions and discussion sessions. Thank you very much.
To hear about that kind of changes in behavior and attitude when it's brought in a holistic approach when working with communities and with individuals as well. And I guess building off of that, Lubna, what has been your experience and what are things that positively contributed to the program design that InterSource is working on with its partners?
Of course, building on what Maram said, because they are actually our main local partner here in Jordan, I would say InterSource during the last period, especially the last program we closed very recently, we depend a lot on the outreach activities, which including local partnership with local community-based organizations, also the establishing of the community-based protection committee. That was very actually a successful story for us. And especially not only the community-based organization, but also working with association for a person with disability, and the initiative they created through these community committee. It was very nice. It was very good, and especially that tackled a very specific protection project like gender violence, gender-based violence, actually social norms, child protection, and even inclusion of the person with disability. Beyond this, also InterSource recently, or let's say during the last two programs, we start to phase out from the cities and focus more on the, let's say, underserved areas, rural area, countryside area, where actually still until now, there is no much service provider in this area. For example, like south of Jordan and also all the valley area, it's very, the organizations, or let's say the humanitarian community is there, but their presence is very limited until now. Also recently, InterSource working on doing a lot of capacity building for local community-based organizations. And through this capacity building, we try, or let's say we are trying to build like accountability network through them, which encourage people to report more about GBV in general, and also sexual exploitation abuse incidents in particular. I think this is what we do in addition to what Maram has been saying. Thank you.
Excellent. Thank you, Lubna. I just want to take this opportunity to remind, well, I should not remind, to tell our attendees that we're dropping in resources in the chat. So make sure to take a look at the chat every now and then. And yeah, check out the rich resources that we'd like to share with everyone in link to the conversations that we're having. So we have talked about the enablers, positive aspects that contribute to better programming and better service provision and better cash programs. But within every context, there are barriers that we also need to work around and to make sure that we're factoring into our decision making. So yeah, I think, Anura, I'll start with you again. What were barriers that you faced when you were thinking about program design and implementation, and how did you overcome these barriers?
Yeah, sure, dear. So let's talk about from participants' perspective or program participant lens, and let's talk about those minorities who have less access to GPV service providers, different parties. So minorities here, we're talking about, for example, of course, not limiting to this example, early marriage cases. I'm talking about below 18 years old. It's illegal to receive cash through the official financial service providers. You know, you can also count on the different types of minorities that we do, and we make sure they are included in our programs. So accordingly, we're building design or distribution methodologies to make sure they are receiving the services either through us or through our partners So here we're talking specifically on the early marriage cases or separated unaccompanied cases and other types, of course, of participants. We make sure they are having the proper methodology to receive cash, either through our financial service provider. For those who cannot receive it, we make sure that there are a coordination mechanism taking place with other organizations who can provide cash in hand, for example, because we don't provide cash in hand, but we make sure our cases identified referred to those who can serve them. Would like also to talk about people living in very hard to reach areas and including informal tent settlements, and where there is lack of service provider there, not only for GPV, but also for basic needs. So we make sure that they are reached and their needs identified and also addressed. I would like also to mention here our partnership with Juhud, our local partner. They are completing our services, of course, following the complementarity approach that we believe in. So we make sure those people in the hard to reach areas, including informal tent settlements, reached and also their needs addressed, specifically for the CVA and GPV cases. We use GPV case management. Would like also to talk about our experience in this challenge, working with those who do not registered under UNHCR, because we're following all the regulation in the country. So we're serving only those having IDs and UNHCR ID, MOI number, etc. But this is a challenge, and we're working hardly with them to encourage them to register and also make sure to be referred to the relevant organization who make sure serving them. These are the main challenges that we are facing when it comes to the CVA and GPV programming we faced, and we made sure that all addressed in the program design.
Thank you, Noor. It's really interesting. You know, I'm hearing from you legal components that need to be factored in, be it on an ID base or an age base, and in different areas, and how that looks differently in terms of availability of different options, and the fact that you need to negotiate with external actors when finding solutions. And I think on that point, what do you think about that, Lubna? And what were the challenges that you faced and the solutions that you worked around?
Actually, we always face an issue when we are doing distribution of cash assistance here in Jordan. It's been a long process, actually, and a series of complications and barriers. Currently now in Intersource, we are practically using money transfer agents or financial support agents to distribute our cash assistance. Of course, this is not, let's say, the only modality we use, because as we say in the beginning, and we're doing the presentation, me, Noor, and Maram, all of us, we keep saying this. For GPV case management, the CVA or the cash assistance is definitely not standalone activity. It's definitely linked to the case management process. So what we are facing now, actually, it's the identification process. When we are sending our GPV survivor or vulnerable persons at risk of GPV, when we send them to the distribution point, there is always an issue with the legal process, or let's say the legal identification process from the money transfer agent. And this is what always needed from us a lot of attention in Intersource. So what we do usually now, we are currently depending on having monthly meeting with them. We are doing capacity building for them, like our beneficiary, and also raising their awareness, and also at the same time raising the awareness of the beneficiary who are entitled for cash assistance. For cash assistance. Also, at the same time, to overcome these barriers, we also set, for us as an Intersource, we set like a focal point in each location we have to make sure that they are facilitating the cash assistance distribution. That's it from Intersource. Thank you.
Thanks, Lubna. And I really like the point on working very closely with financial service providers and considering their capacity. I mean, it's one thing to make sure that recipients are safe through our programs and our staff and from us directly, but we also have that responsibility beyond our immediate services and to make sure all of the spaces are up to the quality that it needs to be, but also are safe as they need it to be. So Lubna, what does it look like for you, working from a local actor perspective, but also very closely with communities, as we've learned from you right now? What are some of the barriers that you faced, and how did you overcome them?
You mean Maram?
Did I say Lubna? I'm so sorry, Maram.
هلا احنا كمنظمه مجتمع محليه كفرونت
As
لاين
a local community organization, one of the key barriers that we face, there are huge expectations from the recipients, and they expect that it has to be frequent, and sometimes the standards of providing these assistance could not be applied on all of them. And so we try to enable those or empower those individuals. And so the first point are the high expectations. And to talk about success stories, or when we talk about the integration and referral system within the GBV program, there has been many referrals after their consent to one of the organizations that actually provide financial support that to cover their basic needs. And so we were able to help around 80% of them. And the other challenge is the sustainability of the services. Sometimes the project ends, and they are asking us when the next project will start. And of course, one of the challenges also the conservative culture of the community that could impact the awareness sessions, and especially if it relates to early marriage. And we tried to ease that impact through using the convincing and negotiation skills, and to inform them about the implications of early marriage from a health perspective. Thank you.
عبالي اسالك من ناحيه لانه كلنا بنعرف مش دائما المساعدات النقديه هي
I would like to ask you, we know that cash assistance are not always the proper way to reach the people. So can you tell me about a case that you worked with where cash assistance were not appropriate, so we can reach those people in a safe manner? Yes, I would like to stress on no harm methodology. So we try our best to avoid harming our participants. So cash assistance is not dangerous as a procedure, but we have to look for age and context. And so, for example, if we help a woman that is experiencing GBV or violence from the partner because he's addict or drug abused, so we ask if the cash assistance would make her more vulnerable to be exploited by her husband. So we don't provide assistance in women in such cases. We also know in other cases that cash assistance could assist other people where they actually have no shelter, for example. So it can help them to provide their basic needs. Thank you.
So it's very interesting to hear about all of the available services that are provided. But when we think about providing services and needs in whatever modality, I guess there's two components, right? There's availability and access. So we've heard a lot about the availability of the different services, but maybe we can unpack a bit more in terms of access to these services, be it in terms of knowledge or awareness of what's available. So maybe Noor, you can talk to us a bit in terms of what do you think we can do better to make protection services more known to gender-based violence survivors?
Yeah. In this regard, I would focus more on the referral mechanisms that we already have. We have very well established referral mechanisms among all the organizations and service providers. For example, we're having Amali application. Amali application developed by UNFPA used and including most of the GPV service providers, including government parties, local communities, and also other INGOs. We're part of that application. So mainly we are relying on this application to receive cases, referred cases to us for our services, and also refer cases in addition to the official forms that we use between us and the government. For example, we're working closely with the Family Protection Department. We're working closely with the Family Protection and Child Department inside MOSD, Ministry of Social Development, where we usually receive referrals from their side for our CVA programming, where we make sure we are completing the cycle of the intervention. And here I'm referring to the case management. They don't, in the government agencies or bodies, there is, allow me to say that, a lack of GPV case management. So we are aiming to conduct the side that missing from their side. So we do the case management, providing the services needed to them, specifically the CVA. In addition, we are aiming to enhance the capacities at national level. So we are here we're focusing on the national level, ensuring that they are applying the SOPs, and also a need even to revise the SOPs protocols at national level and make sure they are applying these tools and guidelines, and also to be in line with the global guidelines and protocols for both CVA and GPV. So this is also a goal for CARE Jordan, to work closely with government, enhancing the capacities. In this case, we are aiming to improve the services provided by the government and making sure there is a good level of inclusion. So the systems that I talked about in my presentation, 2 systems, one for Syrians, one for Jordanians, and also aiming in the future for having an exit strategy, not only relying 100% on INGOs, so also building the capacities and expertise at the national level, so they will be able later on to provide the services for non-Jordanians, not only Syrians, supported by INGOs. So we're aiming also to enhance the capacities there. I would like also to talk about the importance of having a diversity of service provider. So this is in a way or another, having more partners, more partners, government, INGOs, local organization as well. Would like also to talk about the effectiveness and efficiency of the referrals. In Jordan, we're having a challenge. For example, an organization referring a case to another organization for CVA, but you cannot imagine the long waiting list for those in need for the CVA. So for example, in CARE Jordan, we are having a massive waiting list in need for CVA programming. But what we do our prioritization. We're having our scoring sheet, and also our mentioned in my presentation, vulnerability-led assessment and opportunity-led assessment. Here we can make the clusterization or the prioritization for the cases. Some of them, if they are in urgent need, we provide emergency cash assistance. Specifically for GPV cases, we're having a specific CVA program for them, multi-payment, depends on the frequency. We're having 3 times for GPV cases, and also depends on their urgency as per our scoring system. We also invested in what we call contact center. This is we developed this as a result or lessons learned from COVID-19 we developed contact center. The aim of contact center to be closely linked with our database system. We're having also a huge database base system. We're existing in the country since 1948. So basically we're having, for example, 600,000 database. We make sure those cases existing in our database system linked to our contact center. And also we are planning to give access to our partners, specifically those are in Amali. So they can make sure all the cases referred to us for CVA, they can track them over our system, and also issuing on-time reports about the status of the referred cases. So this way we are trying to improve the services, protection services, including CVA and GPV case management for the referrals. So I focused on the referral system and how we try to fix this and our also plans. The last thing that I would like to mention here, our plan to have also non-binding agreements with peer organizations, so they will have access to the system so they can track the referred cases, and hopefully this will be expanded to reach government entities. And here I'm talking about the Family Protection Department and MOSD. Specifically, they highlighted the lack or the gap in having a proper documentation system or database system within the government. So we're trying to start working also building a very good database systems at the national level and systems. I'll stop here.
Thank you, Noor. And I mean, personally for me, I'm really enjoying hearing about the intent and the efforts that continue to go into creating linkages, to piggybacking over existing services, building capacities, expanding capacities, and sharing resources as well. Just a quick reminder again, the resources are being dropped in the chat. So CARE's contact center number, the Amali application, and more resources. Lubna, what about you? How do you think we can make access and awareness raising and information sharing stronger for gender-based violence survivors?
I would add for what Noor already say. I think that we are in good, actually, I think we are in good level here in Jordan, as you mentioned before, because for example now, and this is not only me as an intersource, but also as a co-lead for the Cash for Protection and the State Task Force. Actually, we have a lot of active hotline and available with governmental entities like Family Protection and Juvenile Department. There's also Jordanian Women Union, all the humanitarian community from international NGO, local NGO, and also even the community-based organizations. And all these actually can cater a lot of information to anyone actually can call. So it's not only for hotline, but it's also actually can share information about the referral map, the services we have, whether as intersource or as organization who hold the hotline, but also we can refer easily. I would say also we need to work on, let's say, harmonize actually action plan for communication on nationwide in Jordan here, because we all of us working in the same area or even in different area. We have a lot of resources as an international NGO, as even local NGO here, actually as a humanitarian community here. So I really think we need to learn from each other. We need to have a better linkage and learning from the lesson learned and the existing solution we have in order to reach for further and even access more communities to know more about the, let's say, Amali application, what already may have been said. Thank you.
Thank you, Lubna. And that's very interesting. Noor was talking a bit more about digital platforms, and you're talking about different platforms just to make sure that people that can't access digital or online platforms for whatever reason do have different options. And that's always so vital to make sure that availability of options for people to choose from as they feel comfortable. Maram, over to you. What do you think we should do to improve that access and reach?
برأيي صراحة يعني هيك مختصرا يمكن هو يكون المقترح اللي عم بحكيه هو بعيد الأمل، لكن بعتقد إنه يجب إنه
I think my recommendation is maybe long term, but we should think about linking this strategy in order to be a national comprehensive strategy to respond to all the needs. on the political, health, education, all kind of level. And in my opinion, this is what maybe enhance the protection.
Maybe, I mean, it's a great vision for the future, right? This is what we definitely need to work towards, kind of creating that full holistic services for everyone to be able to access in a way. So you all mentioned in different ways the element on harmonization and the importance of coordinating and working together. Lubna, I think you mentioned it just a few minutes ago. So in your opinion, how do you think we should go about harmonizing cash for gender-based violence outcomes? So yeah.
I think currently, as you mentioned, and as me, Noor, and Maram, all of us mentioned, I think now each organization have their own, let's say, different style of cash assistant, whether it's transfer, value, modality, everything. But currently under the Cash for Protection Task Force and also the GBV sub-working group, we are working together to have a new guideline actually. And this guideline is currently being explored with all the GBV implementing partners on the, let's say, on the humanitarian word or vision here in Jordan. We are trying to harmonize at least the cash value to have at least like a minimum and maximum actually threshold or cash value. In the same time, we are working to minimize, or let's say, I'm sorry, not minimize, but harmonize the level of the risk we face usually as in the humanitarian community, or let's say as a GBV survivor, and how we can support to them. I'm sorry, how we can support them or deal with these cases. Working also on having, let's say, also risk assessment needs. We also need to harmonize, and this is also what we are working with it with the GBV sub-working group currently. Also, it's very important for everyone working in GBV understand this cannot be like a set value. Okay, we will give like 150 JD for each case of GBV. This is very different, and each GBV cases, it's really unique case, and it needs to be going step by step and case by case. I'm sorry, and it needs to be truly studied. So that's why we are trying to set, let's say, a kind of guideline for us, and as we say, it's still under development. Inshallah, very soon it will be out for Jordan. Thank you.
That sounds really exciting, and definitely a lot of learning for different sectors within MENA and beyond that. Maram, what about you? What do you think we need to focus on when harmonizing cash for GBV outcomes?
I would like to add that we can maybe update the map of services in regularly and then share it with all the actors. You can see the local organization is the front line, and we can also integrate private and public sector in order to extend holistic services to the people in need. We can identify. The idea is to identify them constantly where they can get legal help, health assistance, and other kind of services. I think
always providing such a new and different perspective from how you work with different communities. And there's definitely a need to kind of make sure that everyone's on the same page when there are sector level agreements. And making sure that everyone's comfortable with what's happening. Last but not least, Noor, what do you think should be done when it comes to harmonization from your opinion?
Well, from the CVA perspective, I would focus here on the minimum expenditure baskets. It's very important to ensure that the minimum expenditure basket is agreed among all the INGOs or the service providers. So this will also contribute to harmonization for GPV and CVA cases and also ensure that cash transfer value for GPV outcomes and transfer value to meet basic needs across GPV survival or at risk of GPV survival or the referrals for these services, and also make sure a referral to multi-purpose cash assistance harmonized across all the INGOs and the service providers. I would like also to focus here on it's very important to have a study focus on the minimum expenditure basket to inform transfer value adaptation to the reflect the fluctuation rate and the change cost of living in Jordan. So the revision of the value needs to be done and should have a range of basic needs can meet and reduce the reliance on the risky coping mechanisms, and also ensuring that increase the negative coping mechanism, for example, exposure to child marriage or early marriage or household tension or domestic violence. So there's a need to revise the current minimum expenditure basket to be in line with the living cost, and also to agree to have a minimum and a maximum rate for GPV cases. This is very important across all the INGOs, instead of having various minimum expenditure basket across all the organization. So luckily that in the working group, in the GPV working group, that we worked on general guidelines for CVA and GPV case management, and we agreed that we should have a minimum rate and a maximum rate to be given for the GPV cases to less reliance on the negative coping mechanisms. The last thing that I would like to mention here, there is from CARE's perspective and our experience, it's very important to have a strong link between the CVA GPV programming and the Women Economic Empowerment Programming and the Livelihood Programming. It's very, very important to invest in this link between, and also moving forward toward a triple nexus approach, specifically that we're phasing out. You know, I mentioned also one of the challenges that we're having, and there is weak linkages between the CVA programming and also the GPV programming. So here we would like to highlight the importance of focusing on women economic empowerment and livelihood. We can use it also as an exit strategy from the CVA programming in general. Yeah.
Thank you, Noor. So it's very interesting to hear that while when you receive a case, it could be an emergency, but it doesn't mean it's a short-term component, and it's things we need to look at a wider and longer-term element. It's not about that emergency payment at the start, it's about going beyond that and really thinking about linkages and continuity, you know, and more sustainable programming for these individuals in general. So on that, I would be interested to hear from you in terms of best practices on that you have seen have worked best in Jordan when it comes to gender-based violence prevention and or gender transformation. Lubna or Maram, over to you in terms of what would you like to share from your experience on the ground?
I will start, and then Mara maybe can end from her point. For us as an InterSource, as I say in the beginning, we are depending a lot actually on the community-based protection committees. They are really an ambassador for us to change, their communities. They have the accessibility. They have practically let's say the community with them. They can listen to them easily. They talk their language, and they can easily, let's say, they can make a little bit change in their thinking and everything about the gender issues, about the social norms, about the stigma, about everything. So for me, actually, it's the community-based committees. It was the best actually solution for us to reach and also to prevent GPV until now. Maram, I hand it over to you. Thank you.
بكمل على كلام لبنى إنه
I would like to continue that prevention activities we in GBV program we use in-depth discussion sessions, and it had an impact in changing behavior and removing bad habits, and maybe in a phrase that prevention is the best way actually to
Shukran. Thank you to you both. Noor, what about you?
Thank you.
What are things that you found to be most effective through your work with CARE?
I would like to focus here in our prevention and mitigation programs or approaches that we globally developed and we adopted at Jordan, to match Jordanian context. The focus here will be on the gender transformative strategies that we are using. For example, we're having engaging men and boys approach, and we're having social analysis action approach. And these two main approaches targeting different groups or different ages. We're targeting age group from 12 to 25, and also another targeted group from 25 up to 60, 70. So we're having different methodologies. These two approaches address the root causes of the GPV and also the issues, for example, social norms, stereotypes, labelization toward GPV. So we are using these two approaches through our very well existing community committees. For example, in urban areas, also in the campus setting, we're having what we call women leadership councils, and we're having what we call community committees, and also we are having what we call child board committees, or children board committees. These three committees, we are using them as a platform to train them, build their capacities in so many topics related to GPV, starting from the women rights, child rights, the different topics, stereotypes related to the GPV, and also after that, this is exposure them to theoretical part of the training consisting of all topics mentioned just 1 minute ago, and also after that they will go to their community and work with the community members, identify issues related to GPV and also related to within their surrounding community. So they will work with the community members to address these things, either through initiating so many initiatives with their peers, or conduct media campaigns about specific topics, or sometimes we're having some kind of initiatives with the government, local government, advocate against GPV or toward GPV issues with community leaders, key members inside their communities. So we're using them to be kind of a change champions within CARE's targeting area. The same applies in camp settings. So these are the main things that we would like to use it as a lessons learned. It's very effective to work with the community committees, to work or to influence their community members using these two main approaches. It's very efficient, it's very effective. And also we had a training with government entities in these two main approaches and tested also in their areas. In addition to our local partner, I would like to mention here, for example, we trained Save the Children and also Noor Hassan Foundation on these two main approaches in order to ensure that we have more impact and reach more, not only through us as a direct implementing agency, but also through our peer organization and also partners. So these lessons that I would like to mention, working on the root causes of the problem.
And excellent lessons from all three panelists and organizations. We're nearing the end of the webinar. So before we jump into the Q&A session, and we do have quite a few questions that came in for all of our panelists, I would like to give you the space. You know, you've talked to us about the market and financial service providers. You've talked to us about other organizations. You've talked to us about the importance of linking programs to public services and government and relevant government ministries. You've all mentioned the importance that local actors play and should continue to play, potentially even in bigger roles moving forward. So kind of taking a step back and thinking about everything you've shared with us today, what are the top tips or recommendations that you would give your colleagues working either within Jordan or within different contexts for them to take forward with them when thinking about cash and gender-based violence programming. Noor, I'm going to start with you. What are your top tips for your colleagues?
Okay, so here I would like to focus on working with everyone, with all stakeholders, and at 3 levels. It's very important to work with national level, with the government, and also ministries, not only a Ministry of Social Development in Jordan or Family Protection Department, but also, I mean, under the umbrella of having holistic approach or holistic intervention from both sides, from protection sides and also development side, and making sure all the services related to GPV, it's covered, either health, legal, social protection, etc., basic needs. All these sectors should be involved in the GPV programming. It's very important to work with them. In Jordan, there is a huge need to build the capacities of systems. I mean, the national system, and all, as I mentioned, sectors, different sectors, health, legal, etc. We need to work and also engage and make sure that GPV programming within their systems, within their services. It's when we're talking about GPV, we're not talking only about protection services, we're talking about health. We have to make sure that GPV services properly provided in the ER rooms, for example, or in the primary healthcare center or secondary healthcare center. It's very important. Inside the courts, for example, we have to make sure that also GPV case management, I mean lawyers, court judges, they need to be aware about the importance of having, they should be trained on GPV topics, and also they are aware how to handle GPV cases. For example, we should make sure that there is a gender mainstreaming across these sectors, ensuring that there is adequate services, and also, for example, gender balance when we're providing GPV services. I would like to give an example. In night shifts, for example, we don't have girls to provide or to do the assessment for the GPV survivor or at risk of GPV. So we have to make sure these systems, different systems, having the proper capacities. So this is what I would like to mention to my colleagues. We all should work enhancing systems, developing capacities, not only in terms of the training, it's in terms of also reviewing the laws, legislations, protocols. The last SOPs developed by the National Council for Family Affairs was on 2018. So I think it's the time now to be reviewed, making sure that gender mainstreaming are there. Also, the national framework for responding to the GPV, the last one was also 4 years ago. So it's a time now to review the protocols and also the frameworks. And yeah, collaborative work. So to be in line with the GRP, I mean the Jordan Response Plan, and also the Jordan Protection Strategy. So we have to have all protection programs designs to meet the needs and bridge the gaps mentioned in different platforms. So this is what I want to share from my end. We're working together, we're completing each other.
Thank you, Noor. And I love the point in terms of we really need to think about the full system and environment that GBV survivors might be exposed to, spaces they might be in, and different people they might have to work with when thinking about creating holistic programming. Maram, from your point of view, from your experience, what are the top tips or the key points you want people to keep in mind?
One of the best tips that I would actually provide for people who are working in such programs, as humanitarian organization, we need to follow humanitarian principles in every and each step of the work. And how can they deal with each case? And we always stress on the principle of respecting privacy. Of course, in addition to what Noor mentioned, also the partnership with other local and other NGOs. And of course, a training also.
there should be update on all topics related to GBV as well.
We seem to have a technical problem with Lubna. She seems to have dropped out of the call. So unfortunately, I'm going to have to move to our final session, final part of our session today, which is the Q&A session. First of all, thank you to everyone that has dropped their questions in the Q&A section or in the chat. Unfortunately, due to the time, we won't be able to address all of them, but we have picked out a few questions for our panelists to address right now. So I'm going to start with a question that someone had posed to all of the panelists. So I'm going to ask the question and then I'll start with you, Noor, and then I'm going to hand over to Maram. So the question is, on national strategies, to what extent have your organizations aligned with the strategy launched by the National Center for Family Affairs earlier this year on ending gender-based violence, domestic violence, and violence against children? Were there any challenges or limitations to align with that strategy? So Noor, I'm going to start with you.
Yeah, sure. And thanks for this is really a very good question. When it comes to, we have to align our strategy to be in line with the national strategies. Specifically, I'm talking about our experience with the Ministry of Social Development and Family Protection Department. It is in line. And the last coordination meeting we had with them, it was last week, in order, because they launched their strategy for GPV shelters. And also they are about to announce for the workshop to announce the implementation plan for the GPV shelter. So more or less we are in line with their priorities, and we make sure that it's embedded within our strategy. And luckily that we are in the process developing our country strategy, our country office strategy. So we make sure that the priorities identified by the Ministry of Social Development, Family Protection Department, they have also a matrix or a priority matrix. I'm talking here about the Family Protection Department, and also for the mental health related to GPV, health practices, and also legal. So we are developing different activities related to address their priorities. But the challenge that we are facing, it's mentioned in the context slide in my presentation, is the funding. Lack of funding, maybe the shift from humanitarian to the development, maybe also another priorities come on the ground, maybe Ukraine crisis, etc. Grab the attention of the donors to other priorities. But there is a need for GPV, linking GPV with CVA, addressing the gaps at national level and local level, different sectors, all within our strategy, our care strategy. And so the gap that we really would like or the challenge that we're facing is the shrinking, and also the lack of fundings. This is the main priority. However, within care strategy, we are still working with those actors, I mean the government actors, and also we're still working with CBOs. We're having around 10 CBOs that we are working with them hand by hand to address GPV topics. But it's very important to have.
Thank you, Noor. Lubna, welcome back. We've moved to the Q&A session, and just to quickly repeat the question for you. So we have a question to all panelists, which we started with Noor. The question is, to what extent has your organization aligned with the strategy launched by the National Center for Family Affairs earlier this year on ending gender-based violence, domestic violence, and violence against children? And were there any challenges or limitations to aligning the organizational strategy with that? I will come back to you to just give you a moment to think about that question. Maram, I'm going to hand over to you.
تمام. بحب أكد على فكرة
I would like to stress that our strategy should be aligned with the national strategy, and we are here actually to address all the gaps. So if I understood the question, have we discussed our strategy with them? We actually did not discuss with him before, but our intervention is mainly healthy intervention regarding sexual and reproductive health. And
hi everyone, thank you. Okay, as an intersource, our current strategy for this year, definitely we did not discuss it with the let's say with authorities here, but for sure intersource is a very active member in all let's say the coordination structure founded in present in Jordan. So we are part of this strategy, and we usually use all the national strategy as part of our proposal writing, our current program, and we always try to have a better coordination with these let's say, relative entity, whether they are Family Protection and Juvenile Department, whether working with the Ministry of Social Development, also Ministry of Labor, according to the type of the work in the sector we do usually. But in general, we are very active as a member of the structure coordination here in Jordan, and we usually have our own opinion, and we are always have a very good coordination with all these related entities. I would say this is now sure that I did not hear actually the whole question very well. Thank you.
Just to build on what you said, Lubna, were there challenges to aligning the strategy to your organization's strategy or ability to align with the national services?
Actually, what Maram was saying, it was correct. We need to have a final, let's say we need to have a common ground between all of us. But in general, we always respected all the national strategies here in Jordan, and we usually try to work through it. And we know there is a gap between us as a humanitarian community and also for the governmental entity. So we are trying to, let's say, working on these gaps with the coordination and let's say the continuous individual meeting, face-to-face meeting, a lot of discussion, a lot of meeting, and they usually the national, let's say, strategy is always presented as part of, it's always presented actually as part of the, it's always adopted by all the humanitarian community here in Jordan usually, and most of us actually listen to it. We discuss it with them when they usually present it to us. Thank you.
That's really interesting to hear, especially in terms of how do you pick up forward, because usually organizations have the resources and strategies set, and making sure that you maintain that flexibility moving forward. I now have a question for each of our panelists, and they are different. Noor, the audience would like for you to share with us a success story of a GBV case that was referred externally and everything was resulted in a positive and successful output.
Okay, shall I share both internally and externally? So a GBV case, maybe last year, identified through our case management team, assessed, and also care service plan developed for her. Referred internally to receive the small medium business, and now she established her small business. She received a grant with around 800 GOD. She started her own business. It was a beauty salon, and after building her capacity, of course, receiving vocational training in this domain, and now she approached us after 1 year. She wanted us to support to scaling up her business, and she managed to also secure a job for another 2 ladies. So this is a GPV case internally served from our protection department, and then referred to our economic empowerment department. So now we're proud of this lady, because now she's relying on herself, less relying on the coping mechanism. She believes in education. She sent her daughter to the school, and also she was at risk of dropping out from school. So this is internal case. We're very proud of this, and we're glad that we managed to refer her to another grant to scale up her business. So this is an internal case. Externally, the example in my mind that a lady faced challenged, it's an early marriage case, suffering from having a marriage certificate. So she has her own issues with this, and after providing her with all the services that we could manage internally, and here I'm talking about the multiple payment to address her pregnancy and also her delivery, etc., etc. And then we managed to refer her to our legal service provider, GSLA. So they managed to support her to have finally a legal marriage certificate. Yeah, I don't know, these are enough. So
no, they're amazing.
They're
amazing.
Okay.
No, thank you for sharing both examples. I think it really shows how support can go a long way for a long term, and how that creates ripples within a wider community where people continue to support each other. And you all mentioned it a bit when you were talking about community structures that you work through. So that's amazing. Lubna, we have another question for you. Someone was asking, how do you think we can best integrate women's economic empowerment programming? How can we integrate gender-based violence topics into women economic empowerment programming in a way that that contributes positively to that overall program and direction?
Actually, I would give an example. InterSource, because I work in different countries with InterSource, we have actually a very good program. It was funded by USAID at that point. It was practically providing protection through livelihood or through education. We manage actually to economically practically empower like 120 ladies. All of them, they are refugee, all of them, they are GBV survivors. And after this training, after this vocational training, during this vocational training, there was a lot of emotional support groups working in it. There was a lot of counseling inside it. And I really think that after the graduation of these ladies, practically they received all the theoretical training, and also at the same time, they received actually, let's say, internship in the labor market. So we are able to hire these people inside the places where they are trained. But for me, actually, the main impact of this project, it was that there is, let's say, almost 2% of these ladies, they are completely stopped, depending on medication or even on psychological counseling. So for me, actually, I would say, including a lot of awareness inside the economic empowerment activities, also at the same time, make sure that the case manager is inside the economic empowerment activities, also make sure that there is a psychologist also following the psychological, let's say, well-being, and also at the same time, giving them a lot of space to express themselves as economic empowerment, and also at the same time, getting from them actually a key messages for awareness raising about GBV. And it was a very good project. And all the material have been developed from this project. It was coming from the beneficiary of the economic empowerment. They are not all of them actually GBV, but most of them, they was at risk of GBV. Thank you.
No, thank you, Lubna. I love this kind of idea of making sure that, we don't forget the human in economic empowerment when we want to support people to move forward in their lives for whatever reason. We only have 4 minutes left. Maram, a very quick question to you before we wrap up. Someone was asking, what measures has your organization used to ensure that a cash-specific risk assessment was done for the cases to make sure you are taking the best decision for whether you provide cash, how you provide cash, and if you provide cash at all?
زي ما حكينا سابقا انه في اللي هي الاس او بي.
As I mentioned before, there are SOPs for delivering cash assistance. So we must make sure that we are all on the same page. The first standard that we must make sure that she needs protection. Second standard, and we must check the urgency of this case, and based on those standards, we can take the decision of MENA.
With 2 minutes to spare, I just want to take the opportunity to thank our panelists for all of your time and all of your expertise, and all of the efforts that you have put in making today such a wonderful learning experience for us all. A big thank you to CARE, InterSauce, and FOSEC, but as well to WRC and CARE International in general for their support as we move forward. A quick reminder about our final webinar series coming to its final event on the 12th of October, where we will be looking at Lebanon when it comes to GBV and CVA. Make sure to sign up. And yes, last but not least, definitely a big thanks and acknowledgement to the donors that make these activities and learning experiences possible, and for these events, specifically SDC and GFFO. With that, have a lovely afternoon, everyone. Thank you for joining us, and see you on the 12th of October. Goodbye.